Healthcare subsidies do remain the central issue Democrats want addressed in a funding bill before the party votes to reopen the government. As it stands, people who don't get insurance coverage through work, Medicare, or Medicaid will see their tax credits expire at the end of this year. According to the health policy organization KFF, insurance premiums for those customers, they would rise by more than 100% without congressional action. For more on how this could all affect you is Julie Rovner. She is the chief Washington correspondent for KFF, also hosts the KFF Weekly Health Policy Podcast, What the Health. Julie, thanks so much for being with us here. What does this all mean, and how will it affect people who are signed up for the Affordable Care Act?
Well, they won't lose all of their subsidies, but they will lose the additional subsidies that were added during COVID. And as it turns out, that's what made coverage really affordable for a lot of people. Since those subsidies were dramatically expanded, we've seen enrollment in the Affordable Care Act plans double from about 12 million people to about 24 million people. If these additional subsidies are allowed to expire, which is what will happen if no action is taken, then they estimate between 4 and 5 million people will drop coverage because they won't be able to afford it anymore.
Can you talk a little bit about what these subsidies really mean in terms of everyday life, in terms of layman's terms? Why are they so important?
Because they basically enable people to have health insurance or not. You know, when the Affordable Care Act was passed, there was all this debate about the mandate, which you may remember, which was eliminated eventually. And it turned out it wasn't the mandate that made people buy or not buy insurance. It was literally whether they could afford the premiums. And when the premiums were made that much more affordable, that many more people signed up. If you take away that additional subsidy that people were getting, and this is people both at the bottom of the income scale and, you know, for a while, no one over 400% of poverty, which is about $100,000 for a family. Those people weren't eligible for any subsidies, and many of them could not afford to buy their own insurance. So if you're self-employed, if you own a small business, if you're a farmer or a rancher, those are a lot of the people who are currently able to afford their health insurance premiums and who may well not be able to do it if these subsidies expire.
So with these subsidies expiring at the end of the year, is there really time to wait on this? Many Republicans are maintaining that there is still time to wait this out.
Yeah, Republicans seem to think that they can do this on December 31st and that will fix it, and it really won't. We're seeing already that in many states, insurers have filed their final rates. People are starting to get their notices of what their premium increases will be for next year. A lot of those people are going to take one look at that notice, or they're going to go to the website and take one look at how much coverage costs and say, I can't afford this, and it's hard to get those people to come back. So basically, every day or every week that passes, you're going to lose more and more people.
Yeah, I can imagine some serious sticker shock when they see that. Julie Rovner, thank you very much for being with us today.
Thank you.